Hi, everyone. This is Governor Gretchen Whitmer. I wish I could have joined you, but I'm glad to be here for just a few minutes. I want to quickly talk about everything we're working on to make you and your family's life better. Last month, I signed an education bill to close the funding gap between schools in Michigan. That means every school in Michigan will get the same amount of money from the state so they can buy textbooks and upgrade their gyms and wood shops and raise teacher pay. It means more nurses, psychologists, and social workers for our kids. The bill also expands free preschool to 22,000 more families, a game changer for busy working parents across Michigan. Another bill I signed sends $10 million in flood relief on top of federal aid to the areas hit hardest by flooding and the thunderous rain over the last few weeks. I know the extreme weather has hurt a lot of families in Southeast Michigan. I promise you, we will work tirelessly to get people the help they need, where they need it, as soon as possible. But we're not stopping there. I have a plan to make long-term lasting investments in our pipes, drains, sewers, and septic tanks, all while creating tens of thousands of jobs. And finally, I can't show up and not talk about the roads. This summer, if you see orange cones and barrels, I'm sorry and you're welcome. That's what you hired me to do. And I'm proud to be getting it done. The first $800 million of our Rebuilding Michigan infrastructure plan is out the door and now being spent on 21 state highway projects all across Michigan. This money will make your commute, your drive to pick up your kids, grab groceries, or go see family or friends a little easier. And get this, it supports over 22,000 good-paying construction jobs. Speaking of plans, we still have a lot of work to do on so many priorities I know we all share. And I got plans for those too. We ought to invest $1.4 billion in childcare to pay early education professionals more and lower costs for 150,000 more Michigan families. We should put $100 million in affordable housing to create 2,000 units, create 1,600 good-paying jobs, and give 6,000 Michiganders a place to call home. And we should put $100 million into Futures for Frontliners, putting folks who served on the front lines of the pandemic on a tuition-free path to education or training. I want to quickly talk about the pandemic too. As we speak, the Delta variant of the virus is making its way through the country and through our state. This variant is more infectious. It's deadlier. But we know how to beat it with safe, effective vaccines. The vaccines are miracles of modern science. Over 195 million Americans have gotten their shots, keeping countless people out of the hospital and healthy. I encourage you, if you haven't gotten your safe, effective vaccine yet, to speak to your doctor or pharmacist about it. And if you have gotten your shot, thank you for doing your part to keep your family, friends, and this community safe. As we speak, Michigan is coming back. Our economic jumpstart is working. We have $3.5 billion surplus. Our unemployment rate is lower than the country's. Our GDP growth is highest in the Midwest. And as usual, we're number one in the nation for auto manufacturing. Motown is still Motor City. I'll continue to work hard to deliver meaningful change that makes a real difference in your lives. It's what gets me up every day. It's why I have faith in our bright future. And I really, really want to thank you all for your prayers and concerns and love you've shown for me and my family through these last 18 months in particular. I appreciate you.
Mel, you are muted. My apologies, everyone. Good morning. Good morning. Thank you all for being here. Welcome to today's presentation of My Sisters and Friends, Conversations That Count, the sequel. Thank you also to Governor Gretchen Whitmer for that update on what's been happening in Michigan. We regret that a scheduling conflict prevented the governor from being here in person, but appreciate her sending remarks. For those who may not know me, I am Elissa Slotkin, AARP Michigan's Associate State Director for Advocacy. About 1 year ago, we gathered to create a shared policy agenda on healthcare and financial issues. That session produced an agenda that called for ensuring that everyone has access to healthcare, lowering the cost of life-saving prescription drugs, making sure there is a universal access to quality long-term care, protecting Social Security, fostering the development of Black women-owned businesses, and improving access to government contracts for minority-owned businesses. Today, we come together with an all-star cast to follow up on that agenda and have a conversation about our health and wealth as we emerge from the pandemic. So thank you so much for joining us. Also, many thanks to our collaborators, the Michigan Chamber of Commerce and the Michigan Bankers Association, and of course, our guest speakers on health and wealth, Paula Autry from the Henry Ford Health System and Pamela Fuertes from Goldman Sachs. I'm excited to note that today we have with us not one, not two, but three of our congressional delegation who are with us live, and we have video remarks from Senator Debbie Stabenow and Congresswoman Brenda Lawrence, who both have scheduling conflicts. Also, it's important to note that all of Michigan's women congressional representatives were invited to participate. We know how busy their schedules are and appreciate the work they do on our behalf. Today, we are focused our conversation on the future of health and wealth for women in Michigan. Get your questions ready and click your video camera at the bottom of the screen if you'd like to be seen as you ask your question on camera, or of course, you can always put it in the chat. So to begin talking about the future of health and wealth, we have one young woman who represents the future. I'm pleased to introduce to you Michigan State University student Autumn Tyner.
Good morning, everyone. We are honored to be here today with a distinguished group of women who are working hard so we all may have a brighter future and quality choices as we age. Thank you so much for your service and your interest in helping us to give voice to a public policy agenda around issues of healthcare and financial security that are important not just to older adults, but to young people as well. We appreciate AARP Michigan State Director Paula Cunningham, who will facilitate today's event, for giving us an opportunity to introduce two distinguished members of Congress. Although she tried very hard to be here with us live today, her schedule did not allow that to happen. So please join me in listening to a brief video by our United States Senator, Debbie Stabenow.
Hello to everyone taking part in today's discussion. And thanks to AARP Michigan for hosting this important event, and my dear friend Paula Cunningham for your wonderful leadership, as always. These past 18 months have been really hard for Michigan women. Many people lost their jobs and with it their health care. Others had to close their small businesses and let their valued employees go. Moms have struggled to balance work and taking care of their children when schools closed. Many of us, including me, have worried about elderly parents who live in assisted living or nursing homes. The pandemic really shined a light on the incredible burden we ask Michigan women to carry every day, and the need for more support to help lighten that load. Well, the good news is we have a Congress and a president who understand that we can't build back better without building up our families. As part of the budget, we're working to continue the expanded child tax credit, which is a tax cut for working families, and to help families cover the costs of things that keep them up at night, from child care to home care to college to health care. Speaking of healthcare, it's time to lower the cost of prescription drugs by letting Medicare negotiate. It's long past time. And we need to ensure that Medicare covers hearing aids and glasses and dental care too, which we're committed to doing. I'm laser focused on providing more support for caregivers and improving access to home and community-based services. We also know that far too many people struggle to get the mental health care they need. I'm so pleased that I've been able to secure more than $135 million in funding for 33 new community behavioral health clinics all across Michigan. So we can finally treat healthcare above the neck the same as healthcare below the neck. Pandemic assistance legislation has helped many small businesses in Michigan, but we know more help is really needed. The Senate recently passed legislation to expand the Minority Business Development Agency. This will help more Michigan women entrepreneurs get the support they need to succeed. The pandemic has been an important reminder of just how much our state and our nation depend on the hard work and talent of women. Protecting our health and our wealth is important, not just for our own families, but for our future. Thanks again for being here today and for everything you do to keep our state and our communities moving. I'm really proud to be your partner.
Thank you, Senator Stabenow. As previously mentioned, elected official schedules are sometimes fraught with conflicting obligations. United States Representative Brenda Lawrence also shared a brief video that we would like to share with you now.
Hello, I'm Congresswoman Brenda Lawrence, and I proudly represent Michigan's 14th Congressional District. I want to thank AARP Michigan for inviting me to speak at this incredible event. And I just wanted to send a personal thank you to all the outstanding women, Black women, and older women of color here who are creating spaces for conversations that really matter. From the district to the Oval Office, from our households to the polls, the women of our country has fought every single day for the rights that we deserve. Now more than ever, we must continue to lead the charge to ensure that women of all ages can achieve the American dream and to achieve all the opportunities that are available. As the co-chair of the Democratic Women's Caucus, I'm working in Congress to advance legislation and policy that supports women and families here in Michigan and across the country, including increasing access to quality, affordable health care, protecting Social Security, and supporting women-owned small businesses. I am a strong supporter of the Elijah E. Cummings Lower Drug Costs Now Act, which would lower the cost of life-saving medications for diabetes, heart disease, and other chronic illnesses. We need to get this passed in Congress because it is far past time we rein in the skyrocketing drug costs. This past year, I introduced the Senior Accessible Housing Act, which would allow seniors to age in place by providing tax credits for any modifications to their home to allow for safe, independent living. We recognize that it is just as important to fight for women's health care and well-being. It's just as important that we advocate for our financial security. Now more than ever, we must support Black women-owned businesses, small businesses, both to create jobs and to ensure better access to essential goods and services right in our communities. As Vice Chair of the House Appropriations Committee, I am proud to have secured $400,000 in funding for the Southfield Accelerator and Detroit Means Business. These organizations help our small business owners and entrepreneurs, especially in those underserved communities, grow and succeed in Southeast Michigan. From healthcare to financial security, we must support women and women of color, because when women succeed, America succeeds. And if we really are going to build back better, build back from one of the worst economic challenges with the pandemic, if we're going to build back better by investing in our infrastructure, we must build back better with women. Thank you, and I hope to see you all soon.
Thank you, Representative Brenda Lawrence. We appreciate their tireless energy and focus to make certain that our generation, as well as our older adults, have access to health and wealth that will improve the quality of their life. If we all lift our voices and work together, then we can create the kind of future that assures everyone has an opportunity to succeed. It is now my pleasure to introduce a woman who is in the Michigan Women's Hall of Fame, the first African-American female to be president of Lansing Community College, the only African-American female in the country to be president and CEO of a majority-owned bank, and now the AARP State Director, Paula Diane Cunningham.
Hey, Autumn, great job. Thank you so much for that beautiful introduction. And thank you for being courageous enough. You know, they say the #1 fear in America is fear of public speaking. Well, you are certainly an encouragement for our future because you're now talking in front of hundreds of women, and you've done a phenomenal job. Thank you, Autumn. And thanks to Governor Whitmer for sending in her video remarks, and Senator Stabenow also for sending in her remarks. We appreciate them taking the time to do that since they couldn't be here with us in person. But ladies and gentlemen, we are now, excuse me, this is live. Excuse me. So I'm all choked up because of our audience, our participants today. It just kind of chokes me up. But anyway, we are honored to introduce our congressional panel and welcome Congresswoman Debbie Dingell and Rashida Tlaib and Elissa Slotkin. We'll be hearing from you in just a moment. And also Representative Brenda Lawrence had another conflict and was not able to be with us in person. So we certainly appreciate her sending her video as well. So I want to remind you, my sisters and friends, I want to remind you that you can ask questions directly by either raising your virtual hand, on the bottom of the screen, or else in the chat. And you can also get directly onto video so we can see you when you ask your question. This is meant to be conversational. We are not talking about talking heads. We want conversation, not presentation. So keep that in mind. And also I brought along one of my dearest friends. I take him to all of the meetings that are really important, and his name is Elmo. I hope all of you know Elmo. Say hi, Elmo. And if you know what Elmo stands for, please put it in the chat. Anyone know what Elmo stands for? People at AARP probably know what Elmo stands for. But one of the things you don't want to have happen today is you don't want to get Elmo'd. Elmo stands for enough, let's move on, okay? So if you start seeing his little head coming up, whether you're asking a question, making a statement or comment, you might get Elmo'd because we want as many people to participate as possible and have as much engagement as possible. So please keep that in mind as you ask questions, and also to our very accomplished members of Congress. We know that you've got so much to share. All right, so let's get started. I'm going to start with a topic from last year's agenda. And Congresswoman Dingell, I think we'll start with you. I think this might be a good question for you. See the agenda on the screen from last year, just to kind of remind you of what women talked about. And they created this agenda. We had a whole list of things, and this was their priority agenda for the next year. We committed to coming back 1 year later and seeing if there's any progress being made and exactly how this agenda looks as policy agenda. We know things don't happen overnight, but hopefully there's some progress or some movement toward addressing these issues that women have identified are critically important. So Congresswoman Dingell, thank you so much. We've got a long history together. You've done some phenomenal work throughout Michigan. And I know just when we were chatting, you were saying, you're not on break. You're working harder now, or as hard now as you ever have. So thank you so much for being here. First question for you from the agenda from last year. Everyone talks about home and community-based services, and people want to age in place. Public sector consultants did a study for us a couple of years ago in our Disrupt Disparities report, and 89% of the people who were surveyed said their preference is to age in place. And so the question, we know that the women are the primary caregivers in their families, but caregiving does impact everyone, not just women, it impacts everyone. But what is Congress doing to address the issue of helping family caregivers? And there are something like 1.3 million unpaid caregivers in Michigan. What's going on in Congress to help?
So Paula, it's great to see you. I'm always happy to be here with Rashida and Elissa. Rashida and I are known as Double Trouble. So, this is a subject that we like to get in trouble on. We've made some progress, but we have a lot more work to do. I'm really hopeful that by the time October 1st comes, and we will have passed both a bipartisan bill and a Build Back Better bill, that we will actually have made significant progress on home and community-based care. long-term care. As so many of you know, the current system that we have in place for long-term care is institutionally based. We have more than 800,000 on our waiting list to even get help to in the current home and community-based program. And Medicaid is the single largest payer of long-term care in this country. And too many people just simply don't have access to it. So Bob Casey and I have introduced a bill called Better Care, Better Jobs Act, which has worked with all of the seniors groups and the people with disabilities. It passed the Senate as part of the bipartisan bill. Last month, we are working on it. Energy, it's a bill that'll be in my committee, the Energy and Commerce Committee. The president himself told me when I was at the White House 6 weeks ago, 8 weeks ago, not to give up on this, that we had talked about this before he ever decided to run for president. We both have had people that we love that have needed caregiving, and we realized how broken the system was. And I'm really hopeful that we will get, for the first time, long-term care bill in this country when we're done with all of this. And by the way, at the same time, you know, what people don't realize is the caregivers aren't paid. So one, their family, and two, even the paid caregivers are women and women of color, and they're underpaid. They don't have benefits. It's a real and significant problem. I mean, there are many that are working 2, 3 jobs and are still living below the poverty line. So it's my hope that we're going to make really significant progress on just this issue alone by the time that this bill passes. And we know that we've got to do it. Another piece of this is the spousal poverty bill that I got passed last year for 1 year, and I hope it'll become permanent. You know, right now that when you do go for long-term care, Medicaid requires that the spouse be impoverished. You can't have any assets, and it's just simply not right. And we want to hope to, you know, someone shouldn't love their spouse, want to take care of them, but not be able to take care of them unless they sell their house or have nothing. So I could go on about this forever, but I got 2 other colleagues here who are really smart too. So
you don't want to get elbowed, right? You don't want to get elbowed.
I don't want to get elbowed.
I really wanted to see Debbie get Elmo. Elissa, you know about Elmo yet?
Of course, you would say that. You would say that.
You would say that.
Yeah, that's why she said double trouble.
I don't care. Fox News. I used Elmo at one of my town halls. Fox News make a whole story about it. But I love it. I love the little Elmo coming up. It's kind of a sweet way of saying time's up. It's great.
Exactly. And then AARP does things in a really sweet way. And that was one that I just
perfect. I'm stealing this.
I've never seen it. It's great.
Well, good. Yes. Well, thank you for that. And you are double trouble. That's why you want to see Congresswoman Debbie Dingell get Elmo. So let me give you the next question, Congresswoman. Let's talk a little bit about the prescription drug prices. We know we've all heard so many heartbreaking stories about people who go to Canada. To get their drugs. We've been fighting this battle a very, very long time about lowering the price of prescription drugs, particularly for health-saving prescriptions, you know, like diabetes and heart disease and things like that. Do you see any change, any progress at all being made in lowering the price of prescription drugs?
Now, who are you going to give that one to, Rashida, or are you
Tlaib, yes.
I know Representative Slotkin is extremely passionate about this issue as well, so I hope she can cover everything. Yeah, but I know that that's something that she again is really centering a lot of her work on. So, but I know one of the most important goals of the reconciliation, or some call resolution bill, is making the cost of prescription drugs more affordable to our American families, particularly our what I call my seasoned residents. Last Congress, the House did pass the Medicare price negotiation provision, which we call HR 3. As you know, our late, wonderful, my forever chair of House Oversight Committee, we called it the Elijah Cummings Lower Drug Costs Now Act. But of course, it died in the Senate when Mitch McConnell was in leadership. And I know that President Biden has called on us, Congress, to allow Medicare to negotiate
with drug companies. And we will really do have a unique opportunity right now, since you do have many of us now, the pathway to trying to get that done might be open through the reconciliation process. As you all know, I think the first time I ever got in Congress, they put me on House Oversight Committee. You should be proud. I mean, House Oversight Committee, you would think under the previous administration that we'd be doing some other oversight, but it was actually around prescription drugs. I remember the first person to ever testify was a mother of a 6-year-old. And she, at the time was 6-year-old, and she had to, I think she was twins, and she had to ration her daughter's insulin to the point that she lost her life. And even as this mother was talking about, she felt this overwhelming guilt. I remember getting up and going up and just embracing her, and Chairman Elijah Cummings saying, "Thank you for doing that." Because I think she truly didn't feel seen, y'all, until the moment that she could come before such a powerful committee to say, it's broken, it's hurting us, we got to do something about it. But we do have a tremendous opportunity right now through the process of the resolution, the reconciliation. You should know Senator Bernie Sanders is going to be here this Saturday in Detroit to really push this issue forward, and saying, because I don't want people, especially all of you, to think, what is reconciliation? That's a process. No, it's a pathway to try to get some of these issues that really are extremely popular among the American people, that folks have been waiting far too long to try to get this done. And again, we can continue to talk about ways of how it gets done, but I think at the center of it is, let's be able to negotiate through Medicare. But I think, Paula, as we continue to move forward, trying to have people understand how that pathway through reconciliation really can impact their life. I mean, we're not talking about this now, but I even talked to my residents about what happened with flooding and why we need to understand climate resiliency and all these other things that are important that can be addressed there. But yeah, this is our time. This is, you hear it all the time, but I'm always looking for pathways, and I think my colleagues do too. And this is one route that we can take to try to address this really big crisis of prescription drug costs in our country.
That's excellent, excellent news. I know that many of you have been fighting this battle for a very, very, very long time. So to see that kind of progress is really good news. Again, I want to encourage folks who are listening in and called in. We had over 500 folks who registered for this. Raise your hand, put your question in the chat. Have a conversation. This isn't just with Paula and these women, these phenomenal women of Congress, but we want you to engage as well. Congresswoman Slotkin, thank you for being here. I know you told us you're going to be a little bit late, but you made it, and we appreciate you making it and being on the call. Also appreciate your military service. I mean, you've been fighting battles for a long time of all types and services, and along with your military service, we want to thank all the folks who are on the call, frontline workers who've worked so hard these past 18 months. We owe you a debt of gratitude we can never repay. So teachers, firefighters, emergency room physicians, all of you who are frontline workers, restaurant workers, all that. Thank you so much for hanging in there with all of us. So Congresswoman Slotkin, I know you might want to comment also a little bit on the question that we just asked, but another regarding the prescription drug cost or price, but also another question we have for you is access to quality, affordable health care. Whether you're in the rural area of Michigan or whether you're in the urban cities, access to quality healthcare continues to be an issue for a lot of people. And so how do we level that playing field a little bit to make certain that, and this is something that came up last year again on our agenda, that people want to have better access to quality healthcare. So anything being done to address that issue?
Yeah, thanks for having me. And just to clarify, I'm a former CIA officer, not a military officer. I served alongside the military. I just feel the need to make that clear, but thanks for having me. And, I think certainly the access to quality care is something that affects urban, suburban, rural. In my rural communities, you cannot deliver a baby in one of my counties. We literally do not have access to that service. You have to go 45 minutes, almost an hour to get to a hospital where you can deliver your child. So it's certainly something that comes up quite a bit. And I think one of the things that I feel like the country really changed from was the passage of the ACA. And it wasn't perfect. It's still not perfect, But when you think about it, that idea that now it's become normal to say that everyone, regardless of whether they have a pre-existing condition, deserves access to care and to not be gouged. That you can keep your kids on your insurance, as I did, until they were 26. That you have access to healthcare even if you lose your job. And I think one of the things that we've tried to do in Congress and have done is extend the subsidies so that that can be more affordable for more people. We have that issue still with the ACA. It's still not as competitive as we want. It's still not the pricing that we want. But one of the things that we're looking at as we turn our heads to these additional bills is how do we make some of those subsidies more significant and more permanent? And I think the important thing is that we, as a country, have the value, right? I think the average person, if you polled them, the value that everyone deserves access to care they can afford. And you couldn't say that 10 or 15 years ago. I think you can say it now. And I think that it goes hand in hand with the prescription drugs. As my fellow congresswomen have said, there is nothing in our lives that we buy where, except for prescription drugs, where we do not get to know the price until we're at the checkout counter. You can price compare a car, a gallon of milk, saline solution. You can price compare anything. You cannot effectively do it on prescription drugs. And that's insane, and that's purposeful, right? It's to make sure you don't understand how these things are priced and why the price of insulin, which was invented in 1921 and the patent was sold for $1, why it's gone up so precipitously in the past 10 years. So I think transparency and then negotiation, as was said, it's just the Costco model. If you buy in bulk, you should get a lower price. It's just common sense. And we're legally prohibited from negotiating drug prices. So I think access to affordable care and transparent and reasonably priced prescription drugs are things that we're poised to be able to act on in Congress, frankly, in the next year, in a way that we haven't in probably the last decade.
Wow. Well, we listened to the battles that you are all fighting on our behalf. And I just want to encourage people in the audience too. This is your battle as well. These are the issues that you have said are important to you. So, writing letters, letting your Congress folks know, telling other people to engage, to get that kind of bipartisan support, regardless of who your elected official is. You've got a role in all of this as well. We can't just sit back and wait for everybody, wait for these wonderful, distinguished women to carry this battle for us. Mary, I see you had a comment, Mary, in the chat. You said Medigap policies have skyrocketed and the subsidy fund runs out soon. I don't know if you want to talk about that on camera, Mary, or if any of our panelists want to talk about that at all, the Medigap policies that have skyrocketed and the subsidy running out soon. Any comments on that one?
Well, Elissa kind of touched upon it, and I actually think that some of this is going to happen in less than a year. We're going to have a really tough month ahead of us as we bring, all of us here are really committed to making sure everybody's at the table. People have different perspectives, I'm a Medicare for all person. I really do believe that every American's got a right to health care. That complete vision isn't probably going to get there this year, but we're going to make very significant progress. One, Elissa talked about expanding the affordable care subsidies, and that will be one thing that happens in the next month, almost for certain. We have to get this bill passed, which is why we all got to come together and get it passed. And that will help begin to address some of that. We are the Lower Drug Cost Now Act, which was introduced last time, which will allow Medicare to negotiate drug prices for a certain amount of the regular prescribed drugs, insulin being among others. I would actually put money on that too will pass. I'm not saying it's going to be pretty in the next month, but I think that's going to pass. And I also, by the way, think that we have agreement. I know Republicans that are going to support this to expand Medicare to include vision, dental, and hearing, which has been one of the first bills. So some of this is going to get addressed in the next month. That concern about the Medigap will be part of all of these discussions. I think that those are, and then the home-based care are 4 of the major provisions, which will be discussed and included during these discussions on the Build Back Better bill, which is really what people don't understand the word reconciliation, but you do understand we've got to build back better. So this Build Back Better bill that we are going to do in the next month is going to take all of this on.
Excellent, excellent. Janice, I don't know if you want to come on screen and ask your question. If you want to, then just come on screen and ask your question. But Janice has a question. Janice Burchin has a question. Is there a form of communication with Congress that is more effective? Is it email? Is it USPS? Is it a letter? What's the best, most effective form of communication? Okay, Congresswoman Slotkin.
I'm just gonna, because we get, I'm sure all my fellow members of Congress, we get thousands of communications. It is true what they say that you listen to your constituents more than like someone lobbying you from some other country or some other state or some other area of the state, right? Like if people tell me you've got X number of constituents who have called in about this issue or emailed in about this issue, I will tell you a lot of people communicate to our office in like form letters, form emails. And my staff will literally give me a briefing every day and they'll say, yes, there's another campaign going on and we've gotten 50 of the same form letter. Well, I'll read the first one, right? But a personal letter with a story, with contact information so that I can call back or my staff can call back from the district, either by phone or by email, at least in my world, is the most effective. We're human beings and personal stories really get us. And connecting a policy issue that we're working on to a constituent on the ground is what we all try and do every day. So I know I get a daily report of what's happening on the phones. In my district, it's usually an even split 50-50 for or against anything that I'm working on. But I know we all are very sensitive to feedback from our communities and that is what is most effective in my office.
Thank you. Thank you. Erica, you've got your hand up. You'd like to ask a question?
Yes, I would. I don't know if I'm on video or not, but can you see me now? Okay. Sorry, it's kind of dark in here. My lighting beast. Okay, there we go. Sorry. We kind of touched upon it, but as we talk about women are primary caregivers for families, there's the Credit for Caring Act that would provide a new federal tax credit for working family caregivers to address the financial challenges of caregiving. Do you support the Credit for Caring Act?
Who wants to take that one? For all of you.
I think it was Debbie's bill. Isn't it Debbie's bill?
Like she's the sponsor. I know she's sponsored. Yes.
Yeah.
It is, and it's not that's part of it. Well, I was gonna let Rashida, you want to go? We're trying to be fair.
I co-sponsored and Debbie's been really leading on this issue. But you all know caregiving is really tough. And so family caregivers need relief from day-to-day responsibilities. One of the things that we have been pushing for as part of discussing the caregiving relief efforts is around, to be honest, paid family and medical leave. And so that is also attached to it. So I'm not just talking about any kind of credits, but also the importance of the fact that we can be the best caregivers, our family members, our loved ones for ourselves. And it is something that is much more holistic. And so we want to be able to support those kinds of efforts as well. So please don't always look at family leave or any of those kinds of efforts is not connected to basically being able to better caregiving efforts for many of our folks. But yeah, no, it is, if you look at the better, and if I get it wrong, Debbie, I apologize, better care, better jobs initiative in there. It's one of the most, I think, aggressive approaches to making sure that we have some sort of way to have long-term care that is, again, much more humane than what we have today.
Debbie, do you want to comment?
Well, I'm going to make an observation just so you know that the three of us have all been caregivers. And, Elissa and I, a couple of weeks ago, I talk about it a bit more, but we're on the floor the night before Carl Levin died, talking to Andy, sharing personal experiences. And the three of us know we're luckier than 99% of the people. And it's a real problem in this country. It's a priority for all of us. And I really do believe I've got to fight to get the amount of money I want in there, but I do believe we're going to finally get something done on all of these things that we're talking about today.
Excellent. That's excellent. You know what, I have to say this. I know this is a bit informal, but chicks in charge. You get it done. It's not the most professional term to use, but we're getting things done. So appreciate that work. Margot Haynes, you have your hand up. You have a question. Margot?
Yes, I wanted to get my video there for you. I'm really concerned about retirement security for Michigan residents, and I wondered, what can Congress do to make retirement savings easier? Thank you.
Who wants to take that one?
So I'll take a stab at it. It's not, I don't want to pretend I have all the details, but there's a ton of conversation going on right now about how to make it easier to save for retirement, how to make more tax credit and protection for that retirement savings, and then other things that would take costs off the table. There is an active conversation about lowering the Medicare age. That's very much a live issue, a debate about what that age would be, but lowering it so that people can get on Medicare sooner and have more of an ability to save. There's a whole bunch of issues that are being discussed all around this idea that we're still making it too difficult for people to save and stay in their homes through aging. And I'm sure my peers mentioned this earlier, but one of the things we're going to be debating is how to basically expand the coverage under Medicaid for people to stay in their homes when they have difficulty taking care of themselves. We all know that it's just the most expensive option to try and put someone in a full service nursing home facility. We all want the option to age at home, and the conversation we're having now is about expanding Medicaid coverage for home visitors who would allow aging people to stay in place. It would be cheaper for people, cheaper for the government, cheaper for everybody, and also what we want emotionally. I think most of us, that option. So there's a whole host of things, but I think the one thing that we're trying to do is take costs off the table for folks so they can age with dignity and with cash in their pockets.
Excellent. Go ahead. Go right ahead.
Yeah, and so this might be just the lawyer in me. My first bill that I passed was about abuse and fraud, and including retirement. So it was including Social Security, but it wasn't including retirement. And so there's a big, obviously, it's the mama bear in me wanting to protect that. So always make sure that we're advocating and pushing back against, and again, abuse and scams and people getting their retirement wiped out is real in our country. And so we want to make sure that protection is in there. So I'm going to go a little deeper. I mean, I think, the top 1% of families own more wealth than the 95%. You've heard these statistics, but I think it's really important to know that half of our neighbors don't have retirement savings plans or even own their own single stock. I mean, nearly half of American workers have no access to retirement savings plan through their employers right now. And so we need to figure out, when I look at the shift, and that's where I think a lot of us will disagree, a lot of disagreement will come, is there's just too many. I mean, the wealthiest 10% own 84% of all stocks. When they speculate, in the middle of all that is our pensions and our retirement funds. That's who takes the hit, y'all. When they go and treat all of it like the casinos. And so, I know according to recent polling, a majority of Americans support holding Wall Street accountable and looking at those transactions. And again, we could be using some of the kind of accountability measure, maybe tax, whatever it is, to help be able to increase access to retirement savings, being able to try to, again, make sure that people can retire with some sort of human dignity. But again, I think it's important to understand that's where most of our retirement is, in these places that are dominated by the wealthy. And again, there's no seems to be any accountability, and you could put as much money in there, and they are the ones really going to continue to speculate and do things and make decisions that might wipe out your own pensions.
Isn't it interesting? I'm sorry, go ahead.
Now, I want to add one other point here, which is the fact of the matter is that women are still only making 82 cents on the dollar to what a man is. So that amount of money is going to make, if you are lucky enough to have a pension, women are also the ones that are the caregivers. So we go out of the, right, you've seen 3 million women have left the workplace because we've been caregivers for both children and elderly parents. And that means your Social Security base is lower than. So I've been working with Jan Schakowsky and others to also address some of those inequities, because those who do have pensions, women make less, and they're the ones that go in and out of the workforce. So that's not there. We do have, I do believe in equal pay for equal work, and the Paycheck Fairness Act is another tool. And it's a very big subject. As you can tell, we all have things to add to it. But there is a very real problem for women, period, on pensions, because they make less and leave the workforce because they are the caregivers to boot.
Isn't it interesting that we started talking about health, and then we kind of transitioned to wealth, to wealth and financial security, and they are so intricately tied together that you cannot talk about one without the other. And I think that's why the agenda that was created last year talked about health and wealth. Those are the most critical issues, not just to women, but to our America, in terms of how we age and how we age with dignity. So let's make that transition. And just to give us a little bit of insight, we have with us today the Senior Vice President and CEO of Central Market Health with Henry Ford Health Systems, and that's Paula Autry. Paula, are you on? She's going to make a few comments today about what she's seen regarding health and wealth during this last 17 to 18 months. Thank you so much. I know you were on vacation or tried to be on vacation, and we pulled you out of vacation to share with us some of your insights. But you've been in this business of healthcare for a long time. So during the pandemic and beyond, what are you seeing are some of the major issues that, particularly those that impact women? Thank you.
Thank you, Paula, and thank you to AARP and everyone taking part in today's virtual event. It's a pleasure to be with you today, and wonderful to be surrounded by such strong female leaders, many of whom inspire and challenge us to lead with courage and conviction while focusing on our own health and well-being. Leading through these times of uncertainty places a tremendous burden on all of us, but women in particular. Those who have chosen careers in service to others, which include healthcare, education, retail, and other service professionals, have been uniquely called to serve. As we mentioned before, since the pandemic began, the impact on schools and childcare further complicated the already complex world many women are expected to navigate on behalf of their families. And given that women today are increasingly found in leadership roles, female governors and other elected officials, CEOs, and grassroots leaders, the importance of caring for ourselves in addition to caring for those in our charge has never been more important. We know the pandemic has taken a toll on everyone's mental health, but that is especially true for women. As been mentioned before, the US Bureau of Labor Statistics estimates that 2.5, I think I heard earlier, 3 million women have left the job market since the beginning of the pandemic, compared to 1.8 million men. For women who left their places of employment, the combination of job loss and family responsibility have only served to increase stress levels. Many of these women have taken on more responsibility, like homeschooling their children or caring for parents unable to safely leave the house. At Henry Ford Health System in Jackson, our commitment to the community we serve is to lead them to better health and well-being at every stage of life. Yet in healthcare, we're actively battling against the ever-present potential for burnout. The pandemic has only underscored the importance of actively managing our own health and well-being while looking after the health and well-being of others. And it's important that our female leaders, physicians, nurses, and other frontline employees begin by taking care of themselves and modeling that behavior for other women to witness. Having been through 3 waves of COVID-19 in our hospitals with numbers on the rise again, we are doing our best to look out for our countless team members and many women who are desperately have a need for respite. These women are not just nurses or ultrasound techs or medical assistants or housekeepers or cafeteria workers. They are wives, mothers, grandmothers, daughters, granddaughters, sisters, aunts, nurses, and so on. They carry thoughts about their family to work. They bring thoughts about their patients to their homes. They live their life in service to others. In the height of the pandemic, our healthcare heroes were celebrated. We need ongoing community support as healthcare workers continue to battle the pandemic, many making significant personal sacrifices to protect patients and communities. I've never been prouder to be in healthcare. It is our job as strong female leaders to listen, to understand, to offer a helping hand of appreciation, and to encourage women around us to put their own well-being back on the top of the to-do list. We are strong and we are resilient, but we also need each other to protect and encourage and to provide relief and lend a listening ear. As I wrap up, I want to thank you for your time and attention today. As we ponder how we can better take care of ourselves in a time when the demands have never been higher, I want to leave you with these 4 little words of inspiration from Author Elizabeth Grace Saunders. Do less, be more. Thank you.
Thank you so much. We appreciate that. And we appreciate your service too, being out there helping to lead through this pandemic. So thank you so much for being with us. All right, let's get back to some of the questions. There's a lot to unpack with those comments and with everything that we've heard. So I know, Lee, you've been waiting at Lee Vandenberg. I was kind of looking at the chat a little bit. Lee, are you on the call? Would you like to show your video or just ask your question? I understand that you had a question regarding Social Security, and then Michelle, you've had your hand up for a while as well. Lee, are you there?
Yes, I am. My question is about millennials and Social Security. Now, a lot of the people I know who are in that age group have absolutely no expectation that Social Security will be around by the time they need it. What can we do to ensure that Social Security will be there for our kids and our grandkids when they retire?
Good question.
Elissa, you?
Sure. I would never presume to speak for a millennial, given that I am a good solid 45 years old. But I would say the support, frankly, often bipartisan support for reforming and expanding and reaffirming Social Security is pretty strong. There's a bill called Social Security 2100, I believe, that is about strengthening Social Security and making sure it has viability into the future. It's interesting, I think millennials may not totally understand what Social Security means to their lives right now, but like any of us, as they age, they will start to become more keenly aware of these things. And I think that the generation that is, leading in Congress right now are doing just a lot of really strong things to try and shore it up. And the good news is, unlike a lot of issues that we work on, which are so politically polarizing, Social Security, Medicare, they tend to be things where even the most cynical politician knows they need to reaffirm these things because the American public depends on them. So it's, I don't know if others want to comment on it, but there is, go ahead, Rashida.
Oh, no, absolutely. And I think Social Security 2100 Act, but I think we need to really invest in our workforce today. That means really trying to figure out how we can help people save more because of high cost of childcare right now. We have to truly address that. Let's be honest about the crippling student loan debt right now. And of course, our broken healthcare system. I mean, the majority of Americans filing for bankruptcy right now in our country is because of medical debt. And, I have a bill that passed the House with everyone's, both I know Elissa and Debbie have supported where, medical debt doesn't deserve to be on your credit report. It should not be treated as if you bought a car. I mean, this was of life and death. This is basically, medically necessary debt that is on there, and it prevents you from accessing housing, employment, and so much more when that debt can't be paid off. And again, we can't treat it the same way, but we have to start somewhere and pushing back against that. But we also, let's be honest, I think making the child tax credit permanent, canceling student debt, and providing Medicare for all of those things are agenda items that I continue to try to press on. And again, I'm being as graceful as possible when people ask me about Social Security. I'm like, fund it. Maybe it's the mom in me, I don't know, but that's how I feel like we need to figure out how we protect our family. And, I was taught in a union household that government is supposed to be about people. And if that's true, then let's start investing in people first. And then we can talk about some of the other supplemental things, not the opposite. I feel like we do the supplemental things and bailing these other sectors out, but then we don't do something and centering around people. And if folks want to be part of that, great, come on in, and then you can also benefit. But if the center is people, then I promise everyone wins. But I think it's really important that we continue to talk about that now. And unlike Elissa, I let people think I'm a millennial, Elissa, even though I'm 45 too. I don't like a millennial. I'm like, sure, okay.
Well, interesting enough, and I know Councilman Dingell, you want to comment on this too, but what's like 50.2% of people in Michiganders rely on Social Security for their primary source of income. That's over 50% of older adults rely on Social Security. So naturally, this is one of those questions that continues to surface every single year.
I think that it's legitimate to worry about it. For retirement, we have a three-legged stool: Social Security, people's personal savings, and people's pensions. And two of the three legs of the stools have been knocked out. Social Security is what too many families. So we have a moral responsibility in the Congress to ensure that Social Security system is stable. I think it is stabler than many of the hysteria that's out there. But I can assure you, with the number of people that depend on it, that people like, you never have to worry about the three of us, but that the United States Congress will make sure that Social Security is strong. It has to be, because it is the safety net for too many seniors in our country. And we are the only industrialized nation in the world that doesn't have, we've got Social Security, but other countries have long-term care and other programs. We need to respect our seniors. We need to take care of our seniors. And these are programs that we have to ensure are successful.
Thank you for that. On behalf of AARP, I can guarantee you that I know our 1.3 million members would be on everybody's doorstep if you start messing with their Social Security. I mean, we hear it over and over and over again. So thank you for that commitment. Jim Whipple and then Michelle, you both had your hands up. I think Michelle, you were up, and then Jim, you're going to follow Michelle. I know you've had your hands up for a while. Thank you. Michelle, you want to ask your question?
Can you hear me? I'm not sure if I.
Yes, we can hear you.
Thank you, number one, for doing this. It means so much to me and so many people in Michigan. Having had stage 3 ovarian cancer and also chronic lymphocytic leukemia, and being being a caregiver for my father who had passed away, but when he had Alzheimer's, I was taking care of him. So my question has to do with long-term care, because although my current husband has long-term care through his employer, he was not able to put me onto his plan because I have 2 pre-existing conditions. And I am very concerned that I turned 65, that if anything happens to me, I don't want him going broke, because luckily for me, when my father, before he had gotten Alzheimer's, he had given me some money that I kept for years in the bank. $10,000 was all I had, and it went to his care in less than a month. And so that kind of frightens me. So looking for guidance or anything that anyone can say that could help with long-term care options.
Well, I'm going to give you 2 different answers, because you're talking about 2 different issues there. Okay. But the Spousal Impoverishment Act is the bill that I was talking about that would protect the spouse's assets or savings. And that's what we are trying to do. We have a problem in this country. Most people can't afford long-term care. It's just simply too expensive. I don't know where I got lucky in my life that when I was young and thought that I would be forever, somebody told me to sign up for it. And I did. It's still expensive, but I've had it for 40 years. When I went to the Congress and nobody could afford it. It's just the most absolutely, it's way too expensive, which is why we are trying to do things with the long-term care, why we are trying to do the Better Care Act, so that most people don't realize that Medicaid is the largest payer of home care or of long-term care in the country, because people can't afford it any other way, so they have to go into poverty. That is all of these things. We got Follow the Money programs. There are many different bills that we are trying to do that are getting exactly at what you are talking about, and will continue to work on.
Thank you for that. Thank you. We are going to shift. Jim, I know right after your question, a very quick response. We've got a couple more speakers here too, and then we want to get to some more questions. So Jim, ask your question, and then we're going to do a little polling of our audience and see what your priorities are. So Jim, thank you.
All of you being here, I've learned a great deal. As you think about the future of nursing homes, especially with COVID and the long care problem, what changes do you see happening, especially with nursing homes?
So thinking about, if I get hear your question correctly, it's thinking about nursing homes and all that happened with nursing homes, what changes do they see happening with nursing homes in light of COVID? Is that the correct? Yeah, okay. Who wants to respond to that? Anyone want to respond to that question?
I mean, I think we all recognize we could have, something should have been done quickly in regards to addressing that. I think we all can agree to that. Of course, I'm not here to blame. I'm just recognizing that as a public servant, that is something that I assure you, the CDC and others will continue to hear from us in House Oversight Committee about, what we could be doing now to prepare. And I think this is, continues, people want this to end, but we all know on this call, this could just be the beginning of something later on that continues to happen and so forth. And so our most vulnerable is something that needs to be at the center of how we proceed, of how to address and stop this virus and spreading and really killing our loved ones. But I agree with you, there needs to be a better plan in how we address this. And I know much of the federal government relies heavily on our state, and our state relies heavily on our county health departments. I know Wayne County Health Department took a while to build up that capacity, where they physically were going to the nursing homes to distribute the vaccinations, to help put in those safeguards for our loved ones in the nursing homes. They weren't prepared, and I think everyone can acknowledge that to be true, and how we can again address that. I know some of my colleagues were really fighting on the supply end, and you all may or may not have remembered there was a real shortage in masks. There was a real shortage in a lot of other, even sanitizer and everything. Yeah. And people were in a crisis mode. And it was months before we got that addressed. So I know some of our delegation was worried on that supply chain and getting that to our state in the amount that we needed. And then some of us were really relying, for myself and on these county calls and saying, when are we going to see you all at the nursing homes? When are we going to see you all building the capacity? Because many of these nursing homes, y'all, are privately run, and there's a layer of bureaucracy and a layer of trusting what that information is coming out of those institutions. And I know that for a fact. One of them I had to deal with consistently. So just, I want you to acknowledge that I think this was a huge lesson learned for myself personally. I don't know, for my colleagues, that we need to be prepared in a situation like this. And again, with our most vulnerable, it's not just about, getting their licensing through the state and they can open shop, but they have to be able to comply with these other guidelines and be prepared to respond to crises like this.
Thank you so much. All right, we want to hear from, do a little polling ourselves. We we have quite a few folks on the line, and we want to find out what your priorities are. Are we advocating for the right things? Everything we've talked about already, AARP is in the middle of the fight, trying to try to help bring about some change. So, we can't do this alone. Your voices matter. They make a difference. And so to talk about what AARP is advocating for in Washington, Denise DeMichele, you're on the call. You want to tell us a little bit about what we are actually advocating for in Washington, D.C., and why you're in the Capitol every day fighting for these particular issues. So Denise, it's all yours.
Hey there. Hi, everyone. I miss my Michigan family very much. And like Paula said, I am at AARP. I work in our headquarters. I currently work from my home in Maryland. And I haven't been to Capitol Hill in a very long time, and I miss it greatly. But we're all adapting to change, like everyone is across the country. And with that change brings so much opportunity to address a lot of issues AARP wants to push forward on Capitol Hill. So I have to say that I think my wine consumption will be heavily reduced after listening to the Congresswoman this afternoon, because a lot of the priorities they are talking about solving this year are a lot of what AARP is working on. And I don't need to go into what they've already talked about with a pathway to get some legislation done. We're excited for that. It's going to be a busy couple of weeks for AARP to get our stuff done. So the main issues we are focused on, laser focused on, is reducing the cost of prescription drugs, financially helping family caregivers take care of their loved ones, establishing a paid leave program. And if they establish it, make sure it includes caring for your older relatives. And also moving forward on a infrastructure package, whatever that means, but hopefully it means broadband and roads and bridges and transit. So that is what I am laser focused, talking to the congressional offices about. Just very thankful to hear from these congresswomen, especially Congresswoman Dingell, who is our co-chair of the bipartisan Congressional Caregiver Caucus. She's there to create this conversation on Capitol Hill about the importance of caregivers. So we thank her for her support. And for Congresswoman Slotkin, I believe she's going to be getting on board to that credit for caring bill that we've been talking a lot about. That credit for caring bill will help eligible working caregivers take care of their loved ones by providing a non-refundable tax credit up to $5,000 a year. So if you're paying out of pocket, like I know Michelle mentioned her story about this, then she can get some help in the future if you're still working. So it's just, we want people in the workforce. We know how women struggle taking care of in the sandwich generation, children and older adults, and the financial burdens it lends on their families. So thank you for the leadership I'm seeing from these congresswomen on Capitol Hill. So that lends the question. I want to hear from what people in Michigan are thinking about and talking about. AARP's priorities. I'm going to ask you, what is most important with what I'm working on to get passed in the next couple of weeks? So if we can put up the poll question, I'm going to ask you, what's important to you? Prescription drugs, the future of Social Security and Medicare, access to capital for women entrepreneurs, financial relief for family caregivers, more home and community-based options for long-term care, and age discrimination in the workplace. We've moved forward with a number of these priorities on Capitol Hill this year and over the years that I've been at AARP. But it's really helpful to know what people back home in the district, in the state, are also thinking about these issues. Just helps me when I communicate to members of Congress and their staff. And I think what we saw today is you getting your questions out, you're getting your stories out, really highlight the importance of all these issues. So keep, sharing your story with them, whether it's via mail or email or on social media. So I think we are.
Excellent. Yeah,
Thank you.
I think the poll should close. We've just got 1 minute left, Denise. So we're
Yeah,
looking
why
at,
don't we close this poll? Because I have one more question, because that's another issue we're coming up to. So it looks like the biggest thing that what's on people's minds is the future of Social Security and Medicare. Always on my mind. Always on my mind. Definitely going to make sure Social Security is there for when I retire. And I know we're talking a lot about this is home and community-based services. I'm not surprised. I mean, we saw in the past year the impact it's made, and I'm thankful for the questions that we've gotten from folks to share their stories and give some insight to the importance of this problem. Next question. It's a quick one. I promise you it's a quick one. The next discussion we're really going to have another talk on Capitol Hill is about telehealth. So how do you pay for telehealth? What means to pay for telehealth? Is telehealth, should it get paid the same rate as if you see someone in person? So you can see the poll question, have you used telehealth for a doctor's appointment in the past year? Because that's certainly, telehealth is not new. It's just became a necessity this year.
and it looks like most of the folks have said they've used some form of telehealth. There's those who have not, and a percentage who don't know how, who don't have access to internet. So we've got some work to do here, right?
Exactly. And that's what the infrastructure package will do, hopefully expand the broadband access for folks. So keep it up. Thank you for letting me be part of it. Thank you for sharing your information, your stories, your opinions. It's been really helpful to me as I continue these next busy couple of weeks.
Thank you so much, Denise. Appreciate that. And then next we've got with our collaborators, we've got with us today, I think we've got Patricia Herndon, who's on the phone, and she has a question regarding or comment regarding what Michigan Bankers has seen. And Patricia is Executive Vice President, Government Relations for MBA. Patricia, are you on the phone?
I am. Thank you.
Oh, you're in person.
You know, thank you for the time. And when I decided that we would join in on this and collaborate with this, I had no idea that on this day I was actually going to be in the middle of this wife, mom, caregiver role. I happen to be at one of the larger institutions in Congresswoman Dingell's district presently, and working through wearing many of those hats. And I am considering myself very fortunate because I can continue in my work role and kind of hybrid some of this sometimes, and not everyone has that ability to do that. So the discussion of financial stability as it relates to healthcare and as it relates to a lot of the different works of the past 18 months and how we address resources that are going forward to help women, whether it is things like helping those that are unbanked get banked, and work through the education process of understanding the rules of engagement in banking. So much of our world from a banking perspective is really addressed at the regulatory level of what we can and cannot do. So things that are sometimes difficult for folks become a bit of a hurdle to individuals getting into the banking system, which really helps people manage those things when they're able to manage the expectation of how to bank. We have come up with, across the industry, a lot of different programs and opportunities for people to get back into financial services so that they can manage that, and it's not as an expensive perspective for them. Some of those are banking products that maybe have less bells and whistles, but have a lot less detriment and some safeguards on those for individuals that are getting back into banking. So we like to see that. We've been working primarily at the state level to see if we can advocate kind of a double down on financial literacy. We believe that it's important for our children graduating from Michigan high schools to be able to be financially literate. So understanding what credit is before it becomes a hindrance to them, understanding how to work within the system and know those rules of engagement, and then also how to then manage, understand what those obligations are when you're going to college or going into the workforce so that you can benefit from the system to the best of your ability to be a potential homeowner, to build businesses. So those are some of those foundational issues that we're working on. The idea and the last poll that you showed with access to capital being really a fifth of the viewers here, their biggest concern has become an increasingly big issue as we work with in Michigan with MEDC, with the federal SSBCI program that's going to be coming into the states, and how we allocate those dollars to help individuals start businesses, grow businesses, help them understand entrepreneurs across the state. There are some technical dollars that are going to be invested there so that people can understand kind of the hybrid and the ecosystem of lending in Michigan. There are microloans. There are other opportunities for smaller dollar startups. And then there are smaller bank loans, there are commercial loans. So helping people really understand where they are in that spectrum of lending and how to best get them into something that suits their need, understanding what good business credit is and how to build that. These are all very foundational pieces that are important to women, helping women move through that. We also know that women in the workforce, we want to help stimulate and bring down those unemployment numbers and get more people back into the workforce. But for a large majority of women, it comes down to childcare. So we want to make sure that there's adequate childcare and that it is priced, or that if we are able to help with that price of childcare as people go back, as children go back to school, but those that are not have an opportunity to do what they need to do to get back in the workforce without wondering who's going to take care of their children. We want to make sure that those federal dollars that are coming into the state are best allocated in home ownership and rental assistance programs to meet the needs of the very most vulnerable. We want to make sure that we have home ownership programs that really make the broad spectrum, and that we make sure that low and moderate income individuals who are qualified and have good credit are able to get into that. If they don't, that we have credit systems and programs to help them improve that to become homeowners. So I've never really been more happy to be part of this industry that is really addressing foundational pieces of women and everyone building their financial security. And hopefully once that security piece is met, then the wealth is also in place. I think I've shared before with some of you that my favorite piece, or one of my favorite quotes, is from Madeleine Albright, and that there's a special place in hell for women that don't help other women. I try to live by that. And I just think that there's so much opportunity for us to take such a difficult year and a half that we've had and really build on that and address some of the gaps that have existed in the past. So thank you for giving us some time today. I appreciate it.
Thank you so much. And I hope everything works out well for you and your caregiving. I appreciate you. Thanks for collaborating with us on this program. And then next, we want to hear a couple comments from Wendy Block, who is Vice President of Business Advocacy and Member Engagement for the Michigan Chamber of Commerce. Wendy, thank you for collaborating with us today. You're on mute. You're on mute. You're on mute, Wendy. There you go.
Okay, there we go. I couldn't unmute myself, so I apologize there. Good afternoon. My name is Wendy Block. I'm Vice President of Business Advocacy and Member Engagement for the Michigan Chamber. And first, I would just want to thank AARP Michigan for the opportunity to be here and to be a part of this great event. It's been a great conversation, and just value the time that our congresswomen are giving to all of us today by joining us and sharing their insights on some important issues. And just to your audience, I see you have over 200 people that decided to give up portions of their lunch hour to engage in this conversation. The Michigan Chamber is a statewide business organization. We have just under 5,000 members across our great state. Our members are across all industries in all 83 counties. And what I'd love to hear from the Congresswomen today is some ideas about the workforce crisis, jobs, the economy, those sorts of things that really just allow our state to be prosperous. And so pretty much everywhere we go these days, we're seeing these help wanted signs, right? I mean, this is just a huge pain point for businesses, and it's affecting other employees as they've had to pick up the slack when employers can't find the workers they need. Businesses are struggling to find those job applicants, to find available workers. There are just too many people without jobs and too many jobs without people to fill them. And I'd say, our members, job providers across our state are doing their part. They're doing everything they can. They're raising wages. They're offering signing bonuses. People are offering cash to interview in some situations, trying to move the needle. They're trying to be flexible, to provide work from home options, et cetera, et cetera. So I guess my question for the Congresswomen is about what they think can or should be done at the federal level to try to further address the worsening workforce crisis and to break down, what we know to be many barriers to employability. In Michigan, we still have over 1 million people, fewer people working today than we did pre-pandemic, and we need to reverse and change that trend. So Congresswoman Lawrence and Senator Stabenow both kind of started to touch on this, but I'm wondering if the remaining Congresswomen have any thoughts or suggestions that they may be able to share with the group.
Thank you so much, Wendy. We'll pull them back on in just a moment, but let's also hear from Goldman Sachs because they're responding to this crisis as well. So we have with us, and then we'll get the rest of the program will be all Q&A. So we'll get back to that question in just a moment. But we have with us Pamela Fuertes, who is executive with Goldman Sachs and 10,000 Small Business Program. And Goldman Sachs has done a phenomenal job of reaching out and helping to support women. So Pamela, thank you for being here with us. And why don't you talk about, Wendy just talked about some, the shortage and making certain that women can get to the next level. So we want the Congress folks to respond to that as well, but talk about Goldman Sachs and what the 10,000 Small Business Program is doing.
Absolutely. Well, thank you. Thank you again, Paula, for the invitation to join such an important discussion. Greetings from Miami, Florida. I'm Executive Director of the Goldman Sachs 10,000 Small Businesses Program in Miami. We are a national program with sites all throughout the United States. We actually have a site in Detroit at Wayne State University. But it's a pleasure to join all of you. Before I begin, I wanted to thank Paula, of course, but I also wanted to thank Deborah Dorman, who I know is in the audience, in the virtual audience. Deborah is a woman business owner of Ceriste Jewelry based in Atlanta, Georgia. And she is also, and Paula is beautifully wearing one of her gorgeous necklaces and designs. And I should also say Deborah is also an alumni of the 10,000 Small Businesses community. And she's also a dear friend. So with that, I also would like to give a big acknowledgement to a former resident of Michigan, Mike Finney. Mike Finney is now in Miami, and he's president and CEO of the Beacon Council, which is the economic development organization. And I know that in Michigan, he works very closely with very many of you on important economic development projects, which is exactly what this program is all about. And when Paula contacted me about this opportunity to speak, I thought, Paula, thank you. It's a timely discussion. With the pandemic ongoing, if you will, we've seen one of the most sharpest global recessions in recent history that has upended personal and professional lives all across the world. And in our country and throughout the world, this pandemic has changed the way we live, changed the way we work, and it's changed the way we operate, quite frankly. We also know that this pandemic has had a disproportionate impact on women. And we also know that women play a critically important role in the world of entrepreneurship. Our program is an economic development initiative that's designed to help small business owners. We were created in 2008. We are an initiative of the Goldman Sachs Foundation. And our mission and purpose is to be of support to small businesses all across our country to help women-owned, minority-owned, and small business owners across various industries in our communities to be successful. We think that one of the best ways that we can be of support to small businesses is by facilitating access to education, to a practical business education program that will help a small business owner know how to position their company for growth. And so whether this entrepreneur has been in business for 2 years or 20 years, our program is designed to really touch on the top levers that are important for the success of any business. And as all of you know, I'm sure that many of you in the audience are entrepreneurs. Entrepreneurs are consistently learning and consistently growing. And so this is what our program is designed to do. Speaking about women, what we know is that women in business and women entrepreneurs face a number of barriers, some that have been addressed in today's panel presentations. But we also know that there are other barriers that we need to address. One of them is the gender barrier. Entrepreneurship exists and we have huge gender barriers. Globally, only 1 in 3 businesses are owned by women. And according to the World Bank, there are more than 12 million women-owned firms in the US that have contributed more than $3 trillion to the economy. And this is an annual contribution. In developing countries, which is something we also track as a program, women entrepreneurship is rising, and we know that there's incredible potential in helping support women entrepreneurs in other countries as well. But speaking about our program and the Goldman Sachs 10,000 Small Businesses program in the United States, one of the things that we track to see how we can be of support is how can we help break these barriers down? Number one, we know that there's concerns about access to financing. We know that there are concerns about industry segmentation. Now, women are faced with that balance, right? That work-life balance that we've spoken about forever in our careers, professional and personal lives. But now, because of COVID, even more so, the family commitments. And there's also, of course, that confidence. Can I do it? Can I be successful? So what we are doing is we're reaching out. We are reaching out to communities all across the United States through each of our 20 sites. And we're saying we are here. We are here as a resource to help small businesses be successful. Our program has 3 components to it, if you will. One is the practical business education, which is really a 3-month deep immersion of an executive business course. The second part is an alumni community. And in today's conversation, there's so much emphasis on the importance of community and why as a community we have to come together. Our program identifies with having a very strong community of small business entrepreneurs. And lastly, we also know that having small business owners at the table for advocacy is extremely important. And so we're really happy to see some of the discussion at today's program. Paula, I think this has been a wonderful program that we are delighted to be a part of and really appreciate the opportunity to join all of you. So thank you very much.
Thank you so much, Pamela. Appreciate you being here. It really is going to take more of a public-private partnership to address some of these issues. So we've got exactly 4 minutes left, and we've got, I think, 2 of our 3 Congress people still with us. Wendy Block's question regarding the job shortage and what's being done to help address that. You've heard about some of the programming that's going on, but it would either any of our Congressmen want to address Wendy's question about the job shortage?
Yeah, I put that in the chat, but and I think many of the AARP members have someone that they've spoken to that it actually costs more to go to work than it is to stay. And so we got to figure that out. I mean, childcare is real. The issue regarding not having human dignity in the workplace and working so many long hours and still being able to struggle. The majority of the American people live check by check in our country. It's real. The data, Goldman Sachs, the banks, they all know it. There needs to be an understanding in reality that the current system as it goes, no matter all the tricking, the different kinds of programmings and what I call trinkets of programming that come out of the private sector is still not working. And so the public, us, the federal government, need to do a better job in providing a force in providing for human dignity. Look, I grew up in Detroit, the most beautiful, blackest city in the country, okay, where every corner is a reminder of the labor rights movement. I'll tell you at that time how hard and difficult it was before unions showed up in the workplace. But my father, 19 years old, with 4th grade education, was able to go work with his hands, an honest job, right? Go work with his hands, get into that Ford Motor Company in Flat Rock, Michigan, and be able to get glasses for his kids because he had healthcare coverage, to be able to, when he became disabled, to be able to have a retirement because it was attached. Why? Because the union negotiated that. So we have to be able to drive around a people-centered approach. It can't just be about profit. It can't just be about driven of like, that's what it costs, because majority of the big corporations right now, and again, you guys left me because Debbie and Elissa, who balance me out, are not here, Paula. But I think it's important to know this. And the reality is, and I think Wendy and Patricia and everyone needs to realize this, I am not a minority in this country that says the systems are broken and that we need to fix it, because it can't be that, oh, we can't afford it. The fact is, we can't afford not to fix the human suffering in our country. And so it's so incredibly important that we speak that truth, and that we have to figure something else out, because we've tried it all. We really have tried to do this little increments of stuff regarding the healthcare, the increment stuff regarding the jobs, increment stuff regarding investment and retirement, and it just doesn't work, Paula. And so we know that. And now we have to realize the federal government is supposed to be about people. That's what I was taught in Detroit public schools. And so we need to figure out how we balance that out, because public-private is fine in some instances, but I think in some ways the people end up getting shortchanged when that happens, because then it's more driven by profit versus by need. And we see that over and over again. So I think, again, I speak for so many that say it is so hard to work in our country and then still be able to just struggle so much. And Paula, the data is there. Majority of people that work in some of these jobs, and yeah, some people will mention Amazon as some of the major ones, but even the other jobs, they're on federal assistance. We, the public, the federal government, are subsidizing for the fact that many of our neighbors are not being paid a living wage. They're not being able to access healthcare from their workplace. They don't get a retirement for working that job. And so that's the reality, is that we end up paying the cost anyways, Paula, when the private sector doesn't do it themselves. So that is I do have to get off at 1. I apologize. So I hope I addressed some of those issues. And of course, I'll continue to be able to have an open door policy for many of the folks that spoke, but please know that, prove it to us. Go out there and do what's right and provide retirement, provide a livable wage. I mean, I love seeing the signs, Paul. You seen them, $15 minimum. I was like, oh my God, they're doing $15. And I'm like, oh, this is great. This is exactly what for the last 7 years. And I got arrested fighting for 15. This is what people have been fighting for. I mean, the people that wait our tables are getting less than $5 an hour, you guys. They can't rely on tips. That's not how you live in our country. We can do better. So thank you all so much. Really appreciate it.
So much. And no one got Elmo'd. Aren't you glad?
I was waiting. I really wanted to see somebody get Elmo'd. Thank you so much, Paula. Bye, AARP family.
Thank you to our listening audience and for participating today. We're sorry we didn't get to so many of your questions. There are a lot of answers that are in the chat. We will also have this on YouTube, so you can kind of go back. We'll also make every effort to answer any questions that we possibly can answer. But maybe we'll do this again. We'll see. But maybe we'll just do this Q&A, this question and answer with our members of Congress. Again, all of them were invited. We so very much appreciate those who took the time to be with us today. And thank you for giving us 90 minutes of your time. Appreciate you and all of our collaborators and speakers. Thank you. Now go out and do what you need to do. Advocate, vote, get involved with AARP, become a volunteer. Let's lift our voices together and make good things happen. Thank you. Have a good day.